Hello there, and welcome to another edition of the Ask Dr. Jack Show. I am Dr. Jack Felix, chiropractor in Omaha, Nebraska. Not trying to give you medical advice, just trying to give you great information that you could easily get yourself over the internet. We're just making it available to you. And
I'm Aaliyah, Dr. Jack's excellent assistant, and today we are going to talk about opioids and back pain. Obviously, opioids have been in the news a lot, and back pain is something that a large majority of us actually deal with, surprisingly. So.
Yes, exactly. So the whole gist of this comes from a research article that I recently read, and it was done by the Minnesota Veterans Administration. And what they were trying to figure out was, should they use opioid pain relievers, or they suggest opioid pain relievers, or non-opioid pain relievers. Anyway, yeah, tough word. Anyway, so they looked at the studies, and they were looking for any studies that related taking these medications to whether or not they actually made the person's life better or actually helped the pain. And guess what? There wasn't any.
Wait.
Yeah.
Pharma didn't test their subjects? They're not their subjects, their products?
They didn't test to see if they actually worked. Yeah, crazy stuff. I don't know how this actually worked. But so, thank you, Minnesota. You guys actually did the test for us because they wanted to find out the answer. And so they developed a very good test. They studied 240 patients, and they studied each one for a period of 12 months. Now, it took them 30 months to do this whole study, but each patient of these 240 was studied for a period of 12 months. They all were complaining of moderate to severe back pain, chronic back pain. Now, the opioids studied were morphine, hydrocodone, and oxycodone, and the non-opioid drugs were the Tylenol family and the aspirin/ibuprofen family.
Okay.
All right. Now, here are the relevant outcomes for the study. Relative to pain, there was no difference, no significant difference between the two groups. So basically, the same number of people had pain at the end of 12 months in both groups, whether you took the really hard stuff or the over-the-counter stuff. So that's kind of interesting. Second thing is how they rated their pain on a scale of 1 to 10. And they did this in a checklist of 19 different medically related symptoms. And relative to the pain, again, there were no significant differences between the two groups.
Okay, so hold on, for clarification. So the group taking the opioid medications didn't have significantly more pain relief as compared to the over-the-counter group, basically.
That's correct. Which to me, and now I've never taken opioids, and I hope I never have to, but you know, I have this idea that, wow, if you are on these things, all of your pain's gonna magically go away, and you have to really watch because you become addicted because it's so amazing, and all this other stuff. So I'm sitting here thinking, how could this possibly be?
Yeah, it doesn't make sense.
Yeah.
Okay. All right, keep going.
All right. Relative to function, which, I mean, let's face it, that's the most important thing. Can you actually function? I mean, you know, if you can actually function better taking some opioids, then maybe you take them because you can get to work, you can work with your family and stuff like that. But again, over the 12-month period, 59% of the opioid group had a change of more than 30%, versus 54% in the non-opioid group.
There was only like a 5-point difference there.
Actually, a four.
Who got
4-point
point difference? Sorry, of who got more functionality off of the drugs that they were taking.
Yeah, so kind of crazy whether or not that would make sense to do something that you could get addicted to.
So easily. Yeah.
Relative to adverse outcomes, the opioid group had significantly more medicine-related symptoms over the 12 months than the non-ones did.
That would be side effects.
Exactly.
For those of you that are unsure, medically related symptoms due to the medication would be
Yeah.
a side effect. And yeah, opioids cause obviously a lot of side effects. They get you high. There's a difference between taking Tylenol and taking,
Hydrocodone.
hydrocodone, obviously.
All right. So yeah. So anyway, so their big coming back from this big study was that neither one of these was a really great thing because neither one actually fixed the problem. Hello, we kind of figured that out. If you're just cutting off the pain receptors, you're not going to actually fix the problem. But they did this study, and that was one of their big reveals there. The next one was they couldn't figure out why anybody would want to do an opioid versus a non-opioid because there really wasn't any statistically significant shifts between the outcomes of the two. So let's get down to this. You got chronic back pain, it's going to be affecting your life. Now, maybe you've gotten to the point where you don't even notice it right now. I mean, maybe you're sitting in your car seat when you're driving and you're shifting positions on a regular, every couple minute basis because the pain going down your legs or in your back or something like that. And you're just done it for so long, you're just used to it. Well, guess what? That stuff's just going to get worse and worse and worse. The longer you wait to deal with a chronic pain, the more there's going to be to deal with. Because eventually that pain's going to get to the point where you can't ignore it anymore.
It's true.
So take advantage of this and of this little warning and do something about it. Give us a call, 402-333-4848. When you talk to Aaliyah, she's going to set you up an exam. And guess what? You mentioned this video, she's not going to charge you for it.
Of course not.
Because we just want people to get checked. Now, maybe we find out there's nothing that needs to be done, which would be awesome. But it didn't cost you anything. How cool is that? Anyway, next week, we're going to go into more in depth as to some of the things that we do for people here. So if you want to stay tuned for that before you make a decision, go for it. But I'm thinking, why wait? Just make the phone call now, and you can find out in person what we'd want to do just for you, not just what we could do for anybody. So anyway, that's it for this episode of the Ask Dr. Jack Show. I am Dr. Jack Bielitz, along with Aaliyah.
Please like, share, and comment below with your questions, and we'll see you next time.
Yes, and that stuff is so important because the more you do, the more people are going to see it. And the more people see this, the less people are on drugs, we hope, because that's what we want to do. We want to get people off of drugs. Have an awesome, happy, and healthy day, and we'll see you next week.